We'll give folks a few minutes here to come in, but thank you all for coming to the DCQI webinar, Vision Zero. I love this series that we're going, and last series of the year. And before we get started actually with today's program, I'd like to thank today's sponsors. We have AMT, Teaming Our Talents for Your Success. So thank you, AMT, for that. So for those of you joining us for the first time, just a little bit about DCQI. DCQI is the district's quality initiative, a cooperative effort by the District of Columbia metropolitan area, transportation industry, and is dedicated to revolutionizing the district's transportation system through innovation. The mission of DCQI is to provide the district's transportation industry a forum that fosters innovation, networking, continuous coordinated quality improvement to ensure a safe, efficient, and environmentally sensitive transportation system that meets the needs of all our transportation stakeholders. So back to our co-host here. I'm Mike Sakata, if you don't know me, President and CEO of Maryland Transportation Builders and Materials Association. And we have the pleasure of Brandon Buckner here, Deputy Assistant at Federal Highway of District of Columbia. Take it away, Brian.
Today's program, we have a great lineup of speakers. Chamai Nago, Transportation Specialist in the Office of Safety and Federal Highway. Mr. Stephen Reed, Highway Safety Planning Manager, Traffic Engineering Division at VDOT, and Andrea Lasker, Vision Zero Coordinator at PG County, DPW. Lastly, before we get started, here are a few housekeeping items. Please feel free to utilize the chat box to communicate with fellow attendees, panelists, and hosts, along with submitting any questions. Recording this presentation will be available within 24 hours. PDA certificates will be issued within a week of the webinar. And lastly, audience Q&A will be available at the end of today's program. So if you have any questions, feel free to put them in the chat and also ask them at the end of the webinar. Our first speaker for this afternoon on Vision Zero, and before I introduce her, I want to kind of just remind the group that this is a webinar series that we're kind of wrapping up, and we felt that safety, specifically Vision Zero, will be a good timely topic. For the last 2 years during COVID, VMT has decreased, but we saw an increase in fatalities. So I just want to kind of remind the group of that, of the timeliness and importance of this discussion. But our first speaker this afternoon is Chamai Nago. Chamai is a transportation specialist at the Federal Highway Administration's Office of Safety in Washington, D.C. Chamai leads initiatives promoting Vision Zero, safety culture, and the safe system approach. She's been with Federal Highway since 1994 and worked in the areas of transportation planning and safety with stakeholders from tribes, federal land management agencies, state, regional, and local agencies, and nonprofit organizations. Chamai holds a bachelor's degree in architecture from the Catholic University of America and a master's degree in planning from the University of Virginia. Everyone, welcome Chamai.
Thank you, Brandon. Thank you for inviting me to this special webinar. And I would like to thank you, the partners from the DCQI as well, for your attention on the topic of Vision Zero. And I'm glad to be here to talk about what Federal Highway can offer for the implementation of Vision Zero. And so clearly, next slide, please, Laurie. So clearly, just like DCQI, safety work requires a lot of collaborations and coordination and partnership. And so Federal Highway works with our partners to drive down the number of fatalities and serious injuries, just like Brandon mentioned earlier, that has been going up. So we work with the National Safety Council and our sister and brother agencies within the US DOT, as well as outside of the US DOT, and the private partners on the Road to Zero initiative. We also work with AASHTO and other states. We work with Virginia, for example, that Steve Reed is a representative from there, from the state. to develop and implement the Towards Zero Deaths National Strategy on Highway Safety. And also we work with the Vision Zero Network to provide technical assistance to the Vision Zero communities or the communities that are developing, thinking about adopting Vision Zero and implementing Vision Zero. So I'm going to focus my talk on Vision Zero today instead of the other two. Next slide, please. So Vision Zero, as you know, as many of you may know, that came from Sweden and very popular at the local level, and it aims to eliminate traffic fatalities and serious injuries, just like the other two initiatives. And today there are more than 50 communities, cities, counties, MPOs that adopted Vision Zero, and many of them have Vision Zero action plan and implementing them. I'd like to know a little bit about the audience. I'd like to know if any body out there in the audience who come from a Vision Zero city or county around the DMV area. If you could raise your hand so we can see how many people are out there, that'd be great. People from DC, Alexandria, or Arlington. I haven't seen the hand raised, so I guess there's no one from the audience coming from a Vision Zero community. All right, next slide, please. You can, okay, great. Thank you, Laurie. I'd like to use a quote from Leah Shaham, who is the founder and executive director of Vision Zero Network. Vision Zero is not a slogan or a tagline. It's a fundamental shift on how we approach traffic safety. So committing to Vision Zero to all of us is not just adopting a slogan or tagline or branding, but it had to be beyond that. And not even, developing action plan and implementing it, and business as usual. But as Leah indicated here, we need to make some change. We need to, if you want to make a difference, we need to make a big change, a big shift. Next slide, please. So that is the change that we had to embrace and implement. If we want to save lives. But at the same time, alongside with making change, we had to continue on what we're doing best. We got this far for using the best practices and the tools, but every now and then we had to reevaluate those tools and practices for their effectiveness and double down on what works. So change and double down on what works are what we need to focus our attention when it comes to saving lives, driving down the number of deaths and serious injuries to zero. Next slide, please. So how can we change? How can we change our approach to traffic safety, as Leah said? So we need to have a better understanding of our partners, of our customers, actually, the road users, all of them, not just the drivers or bicyclists, but all of the road users. And that's us in this meeting. We are all road users. And as human beings, we are vulnerable and we likely make mistakes. And our bodies only have limited ability to sustain injuries caused by traffic impacts. So we need to design and operate the road system as traffic professionals. We need to design and we need to operate the system that can accommodate human beings. So it's a human-centered approach. So we need to also to grow a traffic safety culture, and we need to do it at home. We need to do it at work, and we need to do it with our kids in school and our neighbors in our communities. We need to dig deeper in other aspects, especially equity, when it comes to saving lives, to make meaningful changes. we should approach safety with an equity lens. And we agree that we can only wipe out fatalities and serious injuries if we make sure that our roads are safe for everyone, especially vulnerable users. We're not just talking about vulnerable users in terms of modes like biking or walking, but we're talking about people with, kids, children, and senior, older drivers and older pedestrians and so on, and also those who are impacted by economic and social hardship, and those who live in area that have been disinvested because um, of policies in the past that affected their lives, and they are sometimes unintentional, with policies on transportation or land use or housing, and so we need to take care of that. So all of those are not new ideas, human-centered, traffic safety culture and equity, but they need to be focused and refocused. And we need to go back to them and make sure that they are packaged, they work together. And so they are actually part of the safe system approach. And this is something that Federal Highway is promoting pretty aggressively these days. And if you haven't heard of safe system, please look up start with Federal Highway website, and I have a website address on the screen if you end up with having this presentation. And I believe my fellow presenter, Stephen and Andrea, may be talking about safe system in that context later on during their presentations. Next slide, please, Laurie. And let's talk about double down on what works. We talk about change, now we talk about double down on what works. Federal Highway often promotes safety countermeasures that are proven effective, but usually underutilized. We've been doing this, and we have this initiative called Proven Safety Countermeasures, and we started back in 2008. But every few years, we update the list of the countermeasures. And this year is the year 2021, and we just launched our fourth round of safety countermeasures only about a month ago. It's very exciting. We have new countermeasures that can work for a safe system approach. And everyday counts is another way of promoting countermeasures that are beyond safety. And we are on our sixth route now. But for safety, back in September, our safety units got together and held Safety Summit series. And I hope many of you from the audience have attended those. They were featuring the safety countermeasures that were in all six routes of Everyday Counts initiative. And I have the hyperlinks for things that I'm talking about during this presentation on the slides. So, if you have the presentation, you're welcome to view them. Double down on what works. The next slide, please. So we talk about countermeasures in double down what works. And I think it's beyond just promoting countermeasure. Double down what works kind of apply to how we do business as well. So technical assistance is one of the big part of Federal Highways program, and especially a peer exchanges program. But I'd like to share with you a new technical assistance program on Vision Zero for the Vision Zero communities. I'm happy to say that we've been doing providing assistance to Vision Zero communities for a number of years now, but this is the first time that we package everything in one place so that we have a more strategic way of delivering our help, our assistance. So the major components of the programs are a community practice webpage, a community pairing pilot, peer exchanges, and webinar series. We are developing the web page, and we hope to launch it in the new year for community pairing pilot. Since it's the first time we're doing it, we are piloting with 3 pairs and 2 per pair. And we just kicked off the first pair on Monday, and it's a pair of 2 cities, Richmond and Tampa. And another pair is the Minneapolis and Portland. And we have a pair of MPOs, which are the Metro, which is in Portland as well, and another MPO in Florida, which is Broward County. So please keep an eye out for the launching of the Community of Practice webpage and announcement on webinars. Next slide, please. Other federal highway resources that may be of interest to you are on our website, and also under development, we have a safety culture. We are developing a safety culture tool. It's a self-assessment tool for transportation agency to use to determine the maturity level of their organizational safety culture and how to improve it within their organization. We will finish the questionnaire development and the whole package in 2022 and pilot them before release it, the tool. Other products we have are reports, success stories, and outreach material, as you see here for SAFE system. And we have a report on developing Vision Zero action plans and so on. So please welcome to those information, to those products. Next slide, please. I'm sorry, my voice is a little scratchy. And I also put on the slide, the URLs for several relevant websites that you see here, and also the overall Office of Safety websites. Next, please. And so thank you for inviting me and for your attention. And I hope the information that I presented here, although quick, but may give you some idea on the information and the products and assistance that Federal Highway can provide. And thank you for keeping your community safe. With that, I'm turning back to Brandon. Thank you.
Oh, thank you. Okay. Thank you, Tamara. Our next speaker is Mr. Stephen Reed. Stephen has 35 years of experience with traffic operations and safety engineering and multimodal transportation planning projects, research, and management. He previously conducted project consulting and research work in London, Ontario, Canada, and Virginia. Stephen started his VDOT tenure in the Northern Virginia District Planning Section. He presently leads the statewide highway bicyclist and pedestrian safety planning program. Stephen has a Master's of Applied Science and Transportation Engineering from the University of Waterloo, Ontario, publishing on large truck crash prediction modeling. Everyone welcome Stephen Reed.
Great, thanks, Brandon. Appreciate the opportunity to dovetail on how in Virginia we're implementing Vision Zero through our Towards Zero Deaths initiatives and some of the recent sort of applications, actions, implementation that we're doing that might be of interest to those here today. So next slide, please. So every 5 years, we do work with our safety stakeholders and partners to update a strategic highway safety plan. All of the states are required to do this for our federal safety funding, but it's also a very good thing and the right thing to do. So in Virginia, we do have a vision of Towards Zero Deaths, and we've, in the last few years, launched a website that's kind of a one-stop shop of working with our partners to get information out on that. As in most other states, we look at the 4 E's of safety, of engineering, education, enforcement, and emergency response and medical services. But in our plan, we've added a fifth E of everyone, which ties into the equity considerations that we just heard about. So we're, as you can see, that the plan there, we're just wrapping up our 5th year and are updating our plan. So I wanted to give you a few insights into that update that we hope to have signed off with our new administration in Virginia here in early 2022. So next slide. As you would expect, we have a lot of partners that developed this plan. Of course, our federal partners that you would normally see in a strategic plan on the right side. But of the state departments, just a couple of things that are of interest. At the very top there, you can see the executive leadership team on highway safety, and that was initiated by our present governor to be at the secretary level led group of public affairs officials from each of these agencies to get together to help coordinate our messaging and outreach on safety issues. And we follow the NHTSA calendar for the most part in terms of a lot of the behaviors that we're trying to address in Virginia. The other thing that's happened through this last strategic plan is we've really gotten more engaged with more components of the Virginia Department of Health. Initially, a lot of our work was with injury prevention, with seatbelt use and child booster seats, et cetera. But more recently, we've done a lot of work on health equity and with active transportation. So I'm going to share with you a little bit about that as well as what we're doing to help with our updating our driver's education work manual and curriculum with the Department of Education. Next slide. So with our new plan, we've sort of followed the lead of federal highways, as you've seen with the 5 elements of the safe system approach, and some other states that have updated their plans in the last couple of years are really starting to grab onto and engage with this sort of Vision Zero work that came out of Europe, Australia, and New Zealand. And so we've taken our emphasis areas and we slotted them into each of those 5 spokes or elements of the safe system approach. And with those come the surrounding guiding principles. And so you can see the standard guiding principles, and we have added that our actions will consider equity, which really dovetails into what we just heard. In that it's sort of safe transportation for everyone. And so there's been a lot of work in equity in terms of mobility and connectivity and accessibility, but it is a fairly new concept in terms of thinking about it for safety. And so we've made some advancements in that here that I'm going to show you now. So next slide. So just in terms of the structure, we have our vision of zero and our mission to use the 4 and 5 E's of transportation safety with our goal, which is to reduce fatalities and serious injuries by half in terms of our long range plan, which is VTrans 2045. With those 6 guiding principles, we came up with 5 overarching strategies and then developed actions in those 13 emphasis areas that I listed on the last slide for you. So that's sort of the hierarchy of our plan and how we're trying to get to those programs, projects, initiatives to implement over the next 5 years. Next slide. So in terms of infrastructure, we're really going back to those proven countermeasures. Again, a good dovetail there. We've over the last 3 or 4 years really been focusing on these systemic safety items. So you can see sort of intersection related across the top and roadway departure related across the bottom. And some of these we are wrapping up. The 2 signal projects we're wrapping up on all of our VDOT network, and For those of you that don't know, we maintain 85% of the road network in Virginia, and the other 15% is with a couple of counties and some towns and all of the independent cities, where we'll go next to deploy some of these intersection treatments. There's over 90,000, probably over 100,000 unsignalized intersections in our network. So we have a lot of work to do to identify those priority ones. We've found the top 1,000 and we're working on those. And we're working on our pedestrian crossings first at the signalized intersections. The other countermeasures down along the bottom are longer term because they typically need to match with our paving cycle. So that's, you know, sort of on a 3-year plan where we're looking at those to see where we can incorporate shoulder wedge or safety edge, as it's been trademarked with rumble strips either on the center line or along the shoulder, and then delineation of our curves. So lots of work to do, and grateful for more resources with the new federal transportation bill to help us with that, as well as in 2020, our legislative body passed that we would have a set aside of state funds to help deploy both behavioral and these infrastructure improvements. Next slide. One of our really top focus areas, because a lot of our increase in the last few years has been in bicycle and pedestrian fatalities and serious injuries increasing. And so back in 2018, we started and developed our first statewide pedestrian safety action plan, which had 3 components there. We're working through some policy recommendations. In fact, I just got off a call on one of the 5 recommendations that we've been working through to help promote policy and good best practices in terms of non-motorized safety. But I want to focus on the analysis because that's really driving not only our federal and state safety program, but also all of our capital projects, where we're sharing these high-risk corridors across the Commonwealth with our localities to propose and submit application for our capital program, which is called Smart Scale. So I'll go on to the next slide, please. So here's an example of that PSAP network. We've identified and priority ranked each segment of our highway network and then combined those into corridors. And we publish the top 5%. So we have sort of the subset, which is the top 1%, sort of the highest risk and propensity for non-motorized travel are in those corridors. And then the next 4% into the top 5% statewide that you see there in blue. So those are the corridors where we're really focusing not only our safety funds, but for our localities and NPOs to submit projects for capital improvement projects, you know, more pavement, steel, and concrete. Next slide. One of the initiatives that I mentioned with the Department of Health has been not only using their data, what they call their Health Opportunity Index, to define where these corridors should be. And that index is 13 social determinants of health, which includes socioeconomic variables, as well as health characteristics, accessibility to food and walking and transit, etc. And we were working with their Walkability Action Institute, but with a grant that we received back in 2019, we really engaged in a much deeper collaboration and launched what we're calling VirginiaPaths.org that came about this fall, which is a website of resources for our public health partners to collaborate and coordinate with planning and engineering in order to prioritize active transportation, health, and safety together. So we're proud of that, and we think we're the first in the nation to launch this sort of initiative together from that CDC grant. Next slide. So to wrap up, our next step is to get this strategic plan adopted by our new administration that's coming in January. And the existing or new agency executives to sign a charter to be engaged in that partnership. We do want to continue to expand our health equity and transportation equity efforts beyond just active transportation into and occupant protection into some of the other areas of safety. And we have some research ongoing now to see where that needs to be affected beyond just these pedestrian priority corridors. And then we also want to continue our work with regional and local Vision Zero safety planning efforts. So we're actively engaged with Arlington, Alexandria, and Richmond that have adopted that as jurisdictions, but also our NPOs and working with transportation safety planning with them as well. So I hope this has been a good overview of sort of how states are starting to engage with the Vision Zero effort, even more so with the safe systems gaining inertia now here in America. Thanks for your time.
Thank you, Stephen, for your overview. Okay. Our last speaker for this afternoon, before we have our open facilitated Q&A, is Andrea Lasker. Andrea is the Vision Zero Prince George's County Coordinator and Special Assistant for Policy and Program Development in the Office of the Director for Prince George's County Department of Public Works and Transportation. Andrea leads the county's Vision Zero efforts, working with interagency groups to plan and implement safety improvements focused on all road users to emphasize a safe systems approach to traffic safety. Prior to joining DPW&T, Andrea worked at New York City Department of Health and Mental Hygiene, promoting environmental health, livability, and the built environment and regulatory enforcement programs. She holds a bachelor's degree in English and a master's in environmental policy from the University of Wisconsin-Madison. Everyone, welcome, Andrea.
Great. Good afternoon. Thanks so much. My name is Andrea Lasker, and it's a pleasure and an honor to be with you all here today. Next slide, please. So the Prince George's County Executive and agencies have made a commitment to make meaningful progress towards safe mobility for all users. And next slide. We just wanted to emphasize that big cities aren't the only entities embracing Vision Zero. And as we know, the Vision Zero network, which has been mentioned before, highlights a lot of this. So while many of the first communities in the United States were larger cities, there are many growing smaller communities, suburban communities, who are shifting towards the safe systems approach to Vision Zero. Next slide, please. So Prince George's County is complementing crash data with residents' experiences, and we're looking for forums to make sure that everybody's voice is heard. As in many Vision Zero communities, we're trying to emphasize equitable input and outcomes through this work. And of course, we have limits to our staff and our budgets. So really, we are looking for partners to integrate the Vision Zero approach into all projects and programs and funding decisions. So really looking to change the culture of our way that we're making some of our decisions. Next slide. So we're part of a regional partnership in the greater Washington, D.C. area. And in fact, in 2019, Maryland became the first state to adopt Vision Zero statewide. So we're all looking to borrow good ideas and learnings from each of the other communities and looking at ways that we can scale them for our own work. Next slide. So we're just going to turn and look at a very short and sweet video overview of our approach. So I think if you press So again, we're using a proven approach to ensure that our roads are safe, and we're relying on the 6 E's. And as Chimay noted, we're constantly assessing what we're doing and building on what's most effective and impactful to save lives, so that we can put our resources into the best approaches. Next slide. We're collaborating with a wide range of local, regional partners and experts, and we're looking forward to an even broader approach as we rely on the Federal Highway Administration and their technical savvy. So we're very happy to be here today. Next slide. So some of the specific elements we want to highlight are documented on our website, and we hope that you're able to explore these resources. Next slide. So again, like, we do have an action plan, and it is specific and measurable and operates on a clear timeline. We've involved a wide array of stakeholders, and we're looking for input as we move along. So that's, again, something that's on our website, the progress that we're making on our actions that we've committed to. Next slide. This is a snapshot of our crash data map that's available on our website for the public. In terms of data, we rely very heavily on the state and our data partners for reliable data. This is something that we're learning more and more about in terms of how we can parse things and what we're able to present. So it's been an ongoing kind of collaborative effort in terms of how we're able to show the data, what the restrictions are. Next slide. When we look at the average number of fatal crashes from 2015 to 2020 in the state of Maryland, this just draws attention to why we need a program like Vision Zero and why we all need to be working towards it. Vision Zero, Prince George's County has the highest number of fatal crashes in Maryland, and there are something like 93 fatal crashes in the county. And unfortunately, we reflect the most recent trends of fewer people driving, but more risky behaviors and severe crashes. Prince George's County does have a lot of drivers. And then next slide. And again, when we look at the average number of fatal pedestrian crashes, each year we have something like 21 pedestrians involved in fatal crashes. And so while we've identified the challenges, we have to balance this with recognizing that every life matters and the individuals who are affected by traffic violence. So we don't ever lose sight of why we're working towards these goals. Next slide. So our high injury network is a prime example of the challenges that many local communities experience. We have varying degrees of control over some of the state-owned roads, which are often most problematic for safety. And we also see a divide between urban and rural priorities, and also where we've invested. So this is something that we're constantly grappling with. Next slide. And we do know that our road to success is going to rely on continuing to build a strong relationship with the State Highway Administration and other partners. And we've been fortunate that we have very active partners in this. And our community-based organizations like the Planning Board and Economic Development, we are all working towards envisioning safe communities. So it does feel like we are collaborating more and more strongly in this period. Next slide, please. On our social media, we're promoting our new bike lanes and other infrastructure safety measures, and for example, sidewalks, pedestrian signals, and we do have signage in the county to let people know about Vision Zero. Next slide. So when we turn to look at how is Vision Zero Prince George's County innovative, it's hard to pull out one thread or another. I think a lot of it is around effective collaborations and looking for new venues for community engagement. And these have been reinvigorated since Vision Zero launched a couple of years ago. And they've been, we've always had some of these kinds of strong pieces, but I think the fact that we're all voicing this together is one of the innovative pieces. Next slide. So we've been fortunate to receive grants and technical assistance from a wide range of supporters. And for example, we pursued traffic gardens for the littlest residents. And that was in partnership with Arlington County, and sharing the Be Seen, Be Alert, Be Safe Safety Bee team. So again, just looking at ways that we can rely on what's being out there and what's being tested and adapt it for our own local community. So next slide. When we look at the framework, we were fortunate to work with the Federal Highway Administration on the framework for health transportation planning. Again, we were able to support the transportation efforts to incorporate health into corridor planning studies and learn a lot from that in terms of it being kind of an iterative process. And again, we've been able to work with partners that we might not have previously reached out to, for example, the Prince George's County Healthcare Action Coalition, which are focused on health equity and active transportation, and also the Health Department's Youth Ambassadors Program, since we're looking for champions who can influence their peers and keep the messages going. Next slide. And so how can we work together even more? We're looking at building stronger communication channels with the county council and the 27 municipalities in the county. And we're looking at changing the culture, both within the county agencies itself and beyond to the public. And as an example of an internal shift of culture, we focus on training our own staff, many of whom are out fixing the roads and are the people that residents interact with every day. So this has been a big investment, but I think a worthy investment. And so next slide. Here's a photo of our county executive, Angela Alsobrooks. She's doing her part in taking the safety pledge to help eliminate fatalities and serious injuries as the result of crashes by the year 2040, our overall goal. And we've been very fortunate to have a lot of support from all different players in the county. So next slide. So that's it for me. Thanks so much for the opportunity to share information from Prince George's County. And we look forward to more collaborations going forward.
Okay. Thank you, Andrea. All right, now we'll provide an opportunity for questions. If you have a question, you can put it in the chat. I think we have a Q&A function as well. If not, I have a few questions to get us started. Chimay, in your presentation, you kind of touched on doubling down on what works. And I know you talked about as doubling down, meaning, just kind of utilizing previous safety countermeasures. You discussed everyday counts program for Federal Highway and also just technical assistance opportunities. But when you said that, I was thinking, do you think as an industry, we kind of shy away from what works as it relates to safety in Vision Zero?
I'm sorry, do you mean that we are shying away from?
Yeah, when you make the statement, double down on what works, do you think that sometimes we shy away from utilizing, proven safety countermeasures or other means to meet that Vision Zero goal?
I see what you mean. I don't think we shy away from them, but we like to try something new. We want to try something different. And as the quote from Leah said that, we need to make a shift. So as much as we wanted to double down on what works, we wanted to look outside the box as well. So the SAFE system is one of the solutions that we think will work. It worked in other countries, as Steve said, that it worked in Australia, in New Zealand, and Sweden. So we think it will work in the US if we apply it correctly. Thanks for the question.
Okay, no problem. Okay, it looks like we have a question in the chat. For Virginia, Prince George's County, are they open to have other organizations partner? So I guess it was a discussion on collaboration and partnership. Is Virginia and Prince George's County open to increased collaboration?
Yeah, absolutely. We have fundamentally on more on the behavioral side, a lot of NGOs and private associations and organizations engaged with working on those emphasis areas. And so, yeah, we're always looking for partners, whether they're local, regional, or different other community groups and organizations. Absolutely. And the best way to in Virginia is to go to that tzdva.org website and see if you can find some contact information there, or contact me. I think my email was there at the end of my presentation.
Yeah, I think for Prince George's County, again, we're constantly looking for new partners and trying to reach different audiences. So we're very open to having other organizations partner. And we haven't really come up with any kind of way to recognize the partnerships beyond like being able to be at these kinds of presentations and say who our partners are. I think something that we're looking at for our revamped website is like making our progress on the different actions more transparent and maybe being able to name those names there. So.
Looks like we have a question in regards to presentation slides. I know that the recording will be provided to attendees. I'm not sure about the slides, but I know the recording will be provided if that's useful.
We can provide the slides with it. We'll do both of them. Yep.
Okay. I guess I'll pose this question to all three panelists. Andre, in your presentation, you kind of talked about safety is data driven. And, I kind of thought about, as of right now, what are some data needs that you all think about?
So we're working very closely with our state data partners. They're the people that we rely on, or the organization we rely on for having reliable data, data that's been vetted and we can say is the authoritative source, and being able to have that data in a more timely manner would be something that we're all working towards. I know that there's been a lot of requests. I've got our data lead on the line today. I think she's still here, or else maybe somebody else from Prince George's County wants to jump in with more information about that. But or put something in the chat, I guess. So really, it's just, I think we've recognized kind of where the constraints are with having up-to-date data, which would help inform kind of what we're doing on a day-to-day basis. But we're very much able to look retrospectively on what's happening. It's just kind of the moment to moment. Sometimes we don't feel like, we feel like we would like some more support on that. So.
This is Stephen talking about some of the state issues. I think in recent years, I'm turning on my video. In recent years, we've made a lot of advancements in order to share information like our crash data, our high injury network, our pedestrian safety action plan, priority corridors. So that is going well. I think some of the other related data that goes with that is starting to come along, like where is our, do we have transit provision? And some of our non-motorized accommodations like shared use paths and sidewalks, but that is not complete. So I think looking at all the modes is important, and getting that statewide, let alone at the jurisdiction level, like Andrea is saying, it is difficult, to have that across all of the network. The other area that's of interest and is difficult is getting non-motorized exposure data, count data, so that we see, what the demand is there. So, we're working with different data sources and testing different things there as well. And then the last thing I'll mention is, there's a lot of cloud source data that's available now, and one of them is speed data from one of our providers in Rex. And we're doing a lot of big data analytics with speed data right now to see how we can use that to support our enforcement and outreach to where we have speeding issues on the network. So a lot of big data analytics going on right now. We're trying to combine all those data sets, which is difficult. We're starting to have the tools to do that now. So that's really exciting.
Okay.
Yeah, I mean, I should also mention that our Metropolitan Planning Organization, MWCOG, has a traffic safety work group, and they have done quite a bit of analysis on the data in the looking at the regions. So that's something also that we look at and rely on, and hope to ask them to be able to cut more in terms of our specific county.
Okay, looks like we have another question. It says, given these times that our severity and crash rate has been increasing, how have you measured progress of these programs? Is there less of a rate increase due to these efforts?
I'll try to answer that one, Brandon. That's a
Okay.
really difficult question.
Yeah, I'm trying to read it again.
Especially given what's going on with the pandemic. So we do a lot of work to try to look at what we're deploying with our safety funds and looking at whether or not they're, providing the benefit that we expected, and when we program those projects, and just seeing what happened, particularly with severe crashes during the pandemic, has really thrown a loop into that track. And we're kind of hanging on as we go upside down here. So that in itself, it has been difficult. The other difficulty is tracking where all those improvements are happening. We distribute the money out to our VDOT districts and our localities, and just tracking where all those improvements are happening is a lot of effort in and of itself. But we're attempting to do that. It's just, it's pretty resource heavy. It's not an automated process. But, we are seeing some huge reductions beyond what we thought we were going to get when we looked at the crash reduction factors, crash modification factors that we use to prioritize our projects. So on a project basis, yeah, we're seeing the benefits because, we're addressing where there's high risk and high number of crashes, but across the network, then you start to see fatalities are going up, and serious injuries may not be going down like they were for the last 10 or 15 years anymore. It's hard to see what's going on sort of across the whole network, but on a site-by-site basis, yeah, we're seeing a lot of success.
All right, thank you. I guess this question is geared towards possibly PG and Virginia. Will Prince George's County be trying to accelerate Vision Zero by looking for consultants to help put out an RFP, if not already?
So I don't know if that's in the plans at the moment. We've been fortunate because we've been able to go after different technical assistant grants, and I think that was something that we hadn't put as much focus on, and there's been more grant opportunities in terms of safety. So I know the state has opened it up to local jurisdictions to apply for safety improvements, and there was a new technical assistance grant through the Metropolitan Planning Organization. So that's kind of been our route so far. If we, of course, are always looking for more voices to say, hey, put more into Vision Zero. So, I think as we build that momentum, we'll be looking towards the county leadership to keep investing. So, but we have that commitment already.
Brandon, on a state and regional level in Virginia, yeah, a lot of our work is done in terms of actual projects, but also the sort of the planning and collaboration side of it through through contractors here in the Commonwealth. And so most of that is done through either VDOT district on-call contracts, either with our planning sections or our traffic engineering sections. And those are launched usually on a 3-year period. And then we have in the central office where I work, 3-year term on-call contracts as well for statewide efforts that we work through with our contractors. And so, for example, in traffic engineering, we have 2 of those contracting teams on contract that are ending here in the spring. And so we'll have 2 new statewide traffic engineering contracts. Our planning division has several as well. I think they have 3 contract teams ongoing right now with a later date. I think those will be renewed in 2023. So most of those are in a 3-year cycle here in Virginia, at least through the DOT.
Okay. All right. I wanted to thank the audience for your questions, but also thank our panelists for your presentations this afternoon and also your participation in the Q&A. And I will hand it over to Mike for an official closeout of our webinar.
Yes, definitely. Thank you for all our speakers. Thank you, Brandon, for putting this great lineup of speakers today and organizing, and for all the help with content. And it was definitely very informative for me and for a lot of folks there. We appreciate everybody involved. And obviously, if you guys want to get involved with DCQI, we are seeking strategic planning partners to help continue the successful progress of this initiative. Innovative teams and leaders of all backgrounds, private and public, throughout the DMV area. Please contact Lori Lawler. Her information is on the screen. This is the final webinar of our 2021 Innovation Webinar Series. Next year, we'll be hosting our actual first annual conference. So please save the dates. Save the dates actually will be shared in the next month or so. Reminder, the recording of today's program will be released within 24 hours. PDH certificates will be available within a week of the webinar. And a final shout out to our sponsor, AMT, teaming our talents for your success. Thank you all. And thank you everyone once again for on this webinar for joining us today. Stay safe and see everyone again soon.
Thank you.